But the big question here is, when's the time for a facelift? What age? I have patients come in saying, oh, I think I'm too young for a facelift, or I think I'm too old for a facelift. Well, there's no special age for a facelift. Actually, I've done surgery on facelift patients as old for their first operation in their 80s. And, you know, we're all living longer now, and if you're going to live to be 100, why spend the last 20 years of your life with a face that looks too old for you? On the other hand, I have done actors and actresses and TV personalities in their late 30s because their job demands that they never look old. But those aren't the normals. The normals are that patients usually come in sometime in their late 40s to 50s when they start to see that they're looking perhaps more like their parents. They're starting to see jowling around the mouth, a loss of definition between the face and the jawline, or a profile that just looks too full on the neck. So we do facelifts then in all age groups. Now, when's the best time to have a facelift? Should a patient wait until they're really hanging down, or should they have it a little earlier? Well, if you wait too long and the skin hangs for a long time, it really makes the skin inelastic. In other words, everyone's got springiness in their skin, little elastic fibers like little rubber bands that pull things up. If you stretch those too long, they're no longer stretchy. So having a lift on the early side is a little bit better than waiting until it's really necessary and extensive. So the advice here is, if you're starting to see a little change that bothers you and you want to have it done, probably better to have it done now than to put it off.